Okay. All right, so I think you're unmuted. So I'm going to move this screen over here. There we go. All right, so good evening. This is Dr. Janelle OD, your eye care expert. We're here with our 13th episode of Eye Spa Talks Tales from the Trenches. And today we have a special guest with us. We have a special guest, Dr. Santrell Hart-Moreland. We're going to talk about her and what she's going to bring to us today. But before we do that, we want you to go ahead and like our page, like Dr. Janelle OD, and you want to share. We're going to be doing a lot of great information. It's going to be a lot of great information about preventive care. She is a certified health coach, so we're going to learn a lot. So you want to go ahead and tag your friends, share. There's going to be some great information. You do not want to miss out on this. If there are any questions, go ahead and put your questions in the comments. I promise I'm going to do a better job today of making sure that I monitor the questions. Or you can also text me at 770-375-5591. Any questions that you may have. So once again, I'm Dr. Janelle OD. I'm the CEO and founder of Brilliant Eyes Vision Center and Premier Eye Spa. I started Eye Spa Talk 13 episodes ago, so we're back in June, because I felt like we needed an outlet for us to have a candid conversation about dry eye and ocular aesthetics. What is dry eye? How do we get dry eye? What are some ocular aesthetics things that we can do to enhance our beauty? And what are some things that we should do to avoid and prevent some blunders, some things that can exacerbate dry-eyed ocular surface disease? So they all go together. But today we have Dr. Santrell Hart-Moreland. She is the CEO and founder of Elevated Eye Care. Dr. Moreland and I go back since I've been to Atlanta. I'm in Atlanta 14 years now, and she is my shero. She's one of the few doctors that I met, especially Black doctors, female doctors of color, back when I first moved to Georgia, first started practicing. When I met her, she had 2 practices. She's married. She had 2 kids. I was like, she's doing it. This is who I want to be like. And she streamlined her practices. Now she has this huge practice that's like a house. It's like a mansion down in south of Atlanta. And I think I saw something that she's even about to start using her space for event space. And that's what I'm talking about. Dual purposes. So Dr. Hart-Moreland has a lot of experience. She has really grown her practice. She's someone that I've looked up to over the years being here in Atlanta, and someone that I can always reach out to get some advice on whether it's motherhood, dealing with the husband in the practice. She's just a wealth of knowledge. But also, in addition to being an optometrist, a mom, a wife, she's a certified health coach. So we're going to talk about today how she brings that to her practice and how nutrition plays a big role in our overall comfort of our eyes, specifically in ocular surface disease and dry eye. So welcome, Dr. Moreland. How are you today?
Thank you. I am super fantastic. It is such a pleasure and my pleasure, delight to be with you, Janelle. I love you, Mama. You are rocking and rolling up there in Marietta. I'm so proud, so pleased. I'm just happy to be in your presence. It's just fabulous.
Oh, well, thank you, girl.
Yes. So a little bit about me for your audience, as you gave me a tremendous introduction. I've been doing this for a little while. I started when I was 2. Okay, so I'm a little older than that. But at any rate, down here in McDonough, Georgia, is where I'm practicing currently, as you indicated, a little south of Atlanta. Been doing this for a very, very long time. And my specialty, as yours is too, is dry eyes. I'm all about keeping the eye healthy. And dry eye is one of those conditions that people overlook. They think that their eyes are burning. They think that they're having problems focusing and they're having to blink all the time to try to keep it clear. That little pinkish appearance to the conjunctiva, the white parts of the eye, they think that's normal. Ladies and gentlemen, if you're watching, that is not a normal condition. And that is something that we can absolutely treat, especially in this day and age when we're spending all this time on these digital devices in front of the workstations, the computers, and all of that. It's becoming more and more of an issue for patients. Just the other day, I had a patient come in who, was complaining her eyes were really hurting. She was in actual pain and thought that she had caught COVID in her eye. Turns out, no, she does a lot of computer work. She's a computer guru, so to speak. And it was just, she had a real severe stage of it. And so I'm happy to be on this program with you so we can talk about some things that I instituted for her, some things that your audience can do to make this thing better.
Exactly. So I was telling Dr. Santrell that I wanted her on because we always talk about the after effect, so we're learning now that dry eye is in fact a disease. It can be a symptom that can lead on to a disease state, and we're learning a lot of research that there's an age of onset. But I always like to talk about preventive care, whether it's dry eye, diabetes in the eye, hypertension, whatever it is. We want to talk about preventive care, especially in the area that we're in now. So let's back up a little bit and let's talk about how what are some things that you do in your office when patients come in? We know there's topical drops. We know that there is, a gamut of things that you could do, but do you have a conversation about with your patients about what you're eating? So what are you taking to help, whether it's supplement or actual dietary that could be exacerbating your dry eye?
Absolutely. And so for most of my patients, if not all of them, when they come in, we have a conversation around what they're eating. Unfortunately, especially in the African-American population, diabetes and hypertension is rampant. I'm going to say, I'm not going to say that, but probably about 80% of patients that enter have hypertension. They don't know they have hypertension. We check blood pressure on every patient. And oftentimes I get, and it's like a running joke among my staff members, oh, it's your instrument, it's your machine.
Yes.
My pressure is never this high. Oh my God, I don't know why it's high. It's just high for you. Y'all got me excited, whatever, however, right? We all get that. But because we know as doctors, hypertension, diabetes, inflammatory issues, these all affect the eye. The eye itself, they're not just floating organs. They're connected to a person. We're a whole person. And so we have to do that. We have to have that conversation, which is why a few years back, I did become a certified health coach because I have that conversation. I'm not afraid to say, okay, so Ms. Jones, you're about 50 pounds overweight. Let's talk about what you're eating. You said your blood pressure is high because it's my instrument. I understand that. I get that. But let's talk about what you ate for breakfast this morning. What does a day in the life look like for you? And oftentimes sodium is rampant. We're eating lots of sodium. Are we drinking water? Of course not. Water. What's water? Who drinks water? You mean my tea? You mean my 24-ounce large frappe from Starbucks doesn't count?
No, ma'am.
No, Miss Jones, it doesn't. It really doesn't. And so, yeah, we do. We have the conversations, and it's just as simple as that. Okay, my diabetics in particular, and yes, I check glucose when my patients come into the office because I need to know if you have a high or unmanaged blood sugar level, it's going to affect the prescription that I'm going to give you. I really don't want my patients coming back telling me, Doc, these glasses that I just spent $500 on, I can't see out of. No, ma'am. If you leave out of my office, you're going to see. And so we have to do these tests to know why. We don't, and it's so unfortunate among our populations that the finger prick, the thing that we think is just, as practitioners, sometimes we lose sight of, that's a painful experience for many of our patients that's suffering with diabetes, and they don't want to do it. They don't do it. They just don't do it. And so they're thinking, well, I'm taking my medications and so everything is fine. Maybe and maybe not. And so we do have that conversation, especially when we get numbers that are out of parameter.
So that's good to know. So like I mentioned, you're an optometrist and you're a certified health coach. What was your journey to add that additional training? And was it the experiences that you were having in the clinic that say, you know what, I want to expand my knowledge base on this so that I can comfortably have these conversations with my patients? So tell me a little bit about that journey and how do you go about doing something like that?
Okay, so I'm going to be completely transparent. A few years ago, I was about 100 pounds heavier than I am now. And you knew me when I was a little bit bigger than I am now. And so basically, I just felt, Janelle, like a hypocrite. How can I tell my patients that they need to lose weight, they need to diet, they need to exercise to get their numbers under control? And they look at me and go, well, what about you, Doc? Right? And
so they call you out.
and that just was not okay. And so as I went through my journey, understanding what it is that I need to do, and I have a strong family history of diabetes and hypertension. In fact, my father passed away suffering from uncontrolled hypertension and diabetes. He was almost 400 pounds at 6'2" when he passed away. And so, you know, not only do those conditions just affect the body, but they affect the mental state. Obviously, they affect the eye, but it's not just him. It affected the whole family. And so there are things that we can do to prevent it. We don't have to live the way we do. We don't have to. And when we know better, I'm a strong believer. When we know better, we do better.
Do
And
better.
oftentimes we just have to have the conversation. It's not a day that goes by where my patients, they just didn't know.
Mm-hmm.
Primary care physicians are busy. They don't often take the time to sit down and say, okay, so instead of having frosted flakes and a banana and your coffee with your sugar for breakfast, maybe you should just have a egg with spinach and tomatoes and mushrooms in it. I mean, the thought, okay, well, yeah, that's a viable option, but nobody's ever presented it to me in that manner.
Yes. Yeah.
So yeah,
So
we definitely have the conversations.
And so it's good to have those conversations, because we'll get to this a little bit later. But when you start to have those other underlying conditions, of course, it's going to exacerbate a lot of eye-related issues. We all think about, you know, retinopathy and glaucoma, but we don't think about it exacerbates ocular surface issues as well. So definitely what you eat can cause a gamut of things to happen within the eye. So about the process with the certified health coach, is it classes? Like, what is an optometrist? It's like, okay, A, I'm being a hypocrite, or B, maybe I am fit and I know what to do, but I don't have any, you know, any intellect behind it. I'm just eating the right things. Like, how do I feel comfortable about having these conversations? Is it some courses that I go take? Is it at an online institution? Like, how does that work?
So there is an actual online institution that I partook in. It's the Institute for Integrative Nutrition, IIN. You all can do a Google search on that. And it's a 2-year program. They actually have coursework. We learned there are over 200 different dietary pathways, dietary programs. It's very intense in detail. Now, everybody may not want to go into that depth, but because of my personal history, I wanted to know. Everything is not good for everybody. And I tell my patients that, you know, now, in doing that course as well, it allowed me to actually tailor my recommendations to the patient that's in front of me, because it's not as easy as saying, and we often say, and I say it too, it's like for drinking water, for example, you need 64 ounces or eight glasses of water a day. Well, that's kind of, that's what we used to say. But now, Ms. Jones, exactly how much do you weigh? Let's divide that number by 2. This is how many ounces of water you need to drink every day. And patients are often shocked. What? I got to drink 100, 120, 140 ounces of water a day. Well, Ms. Jones, yes. and that's the bottom line.
I just learned about that, drinking water and your body weight. So yeah, that's important to know.
Absolutely. And then people are, you know, they get a lot of their information and they get a lot of the information from what they're seeing on television, from the things that they see on TV. So they're thinking, you know, Gatorade, these sports drinks, these smart water. Oh, this is great for me because, you know, that's what the media says. I mean, that's what the pictures say, but it's not true. A lot of the things that are in the media, the commercials, the processed foods, things like that, people don't realize, and I think they do, but they may not, you know, embrace it so much. Our food industry is a business. They are in the business to sell product. A lot of the products that they sell are not good for us. They're loaded with sodium, they're loaded with sugars, they're designed to keep us hooked and addicted to them so that we continuously buy them. And so, you know, sometimes we just have to have that frank conversation. Well, we need to stay out of the center aisle and stay on the outside of the grocery stores. You need the produce, you need the milk. Well, not necessarily milk, but you need the meats and the dairy. You need to stay on the outside. Stay away from anything that comes in a box. If it's in a box and you can't understand what the ingredients are on that label, then don't eat that. It's real easy. Our forefathers grew up on whole foods, vegetables, and meats. That's what we were designed to eat. That's what we should do. That's just the healthiest way. So yeah, we can get into all of the different type of foods that we should eat: green leafy vegetables, blueberries, bilberries, the different nutritional supplements like astragalus, echinacea, all of those type of things. But to keep it real basic for most people, vegetables, whole vegetables, meat, and get your water.
Get your water and your body weight. So you say you take how much you weigh and divide it by 2. Those are the number of ounces of water you should be drinking per day.
That's the amount of ounces of water that you should drink on a daily. And for my coffee drinkers, because I'm not one to say don't drink coffee, but for every ounce of caffeine, you need an ounce of water chaser. So I'm not saying don't drink your coffee, but if you got to have that large cappuccino, whatever, however, from Starbucks, however many ounces that is, if it's 12, 18, 24, you need that many ounces of water just to get to baseline, just to get to 0, and then go from there.
What if it's just regular coffee? I don't do all that. I don't do Starbucks. I just gotta have some coffee, and I just put
maybe try
no sugar, just cream. What did you say?
Try the decaffeinated coffee because it's the caffeine.
Okay.
It's the caffeine. So even with tea, because my tea drinkers, if your tea is black tea is caffeinated.
Yes.
So you want to look for the herbal teas. So it's the caffeine that requires the water chaser, right?
So listeners, if you have any questions, go ahead and put them in the comments. I'm watching the comments. Hi Daryl, hi Leon, and hi Marina. They're all listening to us, and we have a lot more people listening as well. So I want to pivot a little bit. So we get off the coffee, and I have to remember to do my body weight in water. I'm trying to do better about water myself. We all know water is very good for our bodies, and also for keeping up the comfort of our eyes. So we both specialize in dry eyes. So I want to pivot a little bit. And so let's talk about that dry eye patient that comes in. We have assessed the patient. We have determined that they have dry eye. It's probably more than likely secondary to some destruction or obstruction of their meibomian glands. We go ahead and recommend whatever lipoflow, miboflow, what have you. But when do we have that conversation about, okay, well, Ms. Jones, going forward to minimize any further in-office treatments, what should you be doing at home to help us maintain your overall comfort of your eyes as well?
So for me, during that initial examination, when I first identify that we have a dry eye issue, I usually have patients come back and do their dry eye treatments, but I usually schedule that like 3 to 4 weeks out. During that 3 to 4 week period, though, I give specific directions on I want this amount of water per day. We've had the conversation. I even give them a water bottle so that they know what they need to drink. I also recommend omega-3s. I do like for my patients to supplement with omega-3s because they're typically not getting enough of that. And I also have them try to stay away from inflammatory foods. So I do not overlook that. The major inflammatory foods, and people don't like it when I say it, but sugar, wheat, dairy, and eggs. Those are the ones. Those are the culprits. Now people are like, oh, I got to have an egg. Oh, how can I not eat sugar? And oh, wheat, that's everything. You mean no more bread?
No.
Okay, just try those things and see, because we are our own experiment, so to speak. If you do what I'm asking you to do for that small amount of time, and it's usually 3 to 4 weeks, and you see a profound difference in not just your eye health, but your total health, you're more inclined to stick with it. Okay. And the treatments that we have to do don't have to be as extensive.
Yes, and don't have to be repetitive, especially with in our population. So one of the focuses that I am taking, as I notice as I dive deeper into ocular surface disease and ocular aesthetics, not only do I not see a lot of doctors treating it, which I know we are, because I can pull many of doctors of color who have private practice, we're just not getting those stages to have the conversations. But in addition, when I'm looking at these cases, I hardly see any cases where the patients look like me or most of my patient base. And so we have these frank conversations with our patients, whether they look like us or not. So when you have a patient says, because I'm thinking like, oh, dang, dairy, eggs, oh, Lord. So what would be a suggested breakfast for somebody who is in this 3-week trial period that want to see if what I'm actually is ingesting in my body is causing my body to have an inflammatory state that's causing the diabetes or hypertension, and in turn making my eyes dry and irritated. What would I eat in the morning? What would I eat for lunch?
So I like to call them eggless omelets. So basically, it's a bunch of spinach with peppers, mushrooms, and tomatoes. Saute that. Yes. And of course, your water. If you have to do juice, that's okay, but get your water in. I mean, I'm not opposed to juice drinkers unless you're diabetic, and then I kind of want you to curtail that. A lot of diabetic patients too, unfortunately, think, oh, well, am I eating a lot of fruits? Fruits are okay. Well, you really should be eating vegetables more so than the fruits. So for lunchtime, that's, to me, is really easy. But lettuce wraps. You can do lettuce wraps. You don't have to have bread. Lettuce wraps are perfectly fine. Fill them with all of the good veggies, and then your meats can be a lean fish, like salmon or tuna or grilled chicken, or those people who like to go out, you can get even I know Wendy's and Burger King does it. You can get a burger with lettuce. I mean, you can get that instead of the bun, because I know both of those places do it, because I partake. Okay. I'm not living in a bubble.
I partake.
And so, and so those are things that
how do you order that? How do you order? So let me get a what is it, Junior Deluxe on lettuce? Like, what do you say?
You said instead of lettuce, you want the bun, right? So if you're going to say to Wendy's, you want a number one without the bun, just the lettuce, and they'll fix it for you. Chick-fil-A will do the same thing with the chicken sandwiches. Yeah.
Oh wow.
So yeah, you just tell them to hold the bun.
Okay. Yeah. Hold the bun.
What else? Dinner, a big salad. But that's when you can get your meat in. You can do your cooked vegetables at that time, because you're at home, right?
Okay.
And then, because I'm not a big advocate of rice, and so I tell people they can do smashed cauliflower. It gives you the consistency of rice. If you like to do stir fries, do your stir fry normally as you would, and put it over a bed of crushed or smashed cauliflower. Same effect. Spaghetti squash instead of spaghetti noodles. So there are lots of things that you can do.
We can't do rice. Now, I'm not a fan of rice, but I want to know, why can't we do rice? Is that the wheat?
So right, and especially for my patients, that not necessarily the wheat part in the rice, it's the white rice that'll kick up your glycemic index. Especially for my diabetics, I don't want them having rice. Just try to avoid that. and white potatoes. Oh my God, don't get me started, Janelle. But
I need to have my husband. He loves some white potatoes. Oh my goodness.
Okay, so you're gonna transition him to yams and sweet potatoes.
Yeah, he'll make both, and then I'm like, why even make the white potato? Just eat the yam.
Right.
So, yeah.
Right.
Yes, we do know sweet potato and yams are better, and white potatoes are not as good. Okay, so I'm learning, so I'm sitting here taking notes. I'm like, ooh, so sauteed is the breakfast that gets me. Now, what about if you know, some people are doing these, what do you call it? The fasting, intermittent fasting, where they may not eat breakfast, or they'll eat their last meal in the evening and don't eat again until maybe lunch. How does that play a role into overall diet and possibly comfort of the eyes, or if you have any underlying health conditions, should you be doing these intermittent fastings?
So most, and it's also kind of time restricted eating. If you can restrict the time of day that you eat to say 6 to 8 hours, so say do it from like 3 to 8 or 9 in the evening, and those are the only times that you eat. Essentially, you're skipping breakfast, and you have an early dinner and you skip breakfast. It's good for the body, actually, Janelle, because it allows the body to rest, to recuperate, to repair itself, especially patients who don't sleep well, partly because of these digital devices that we're on, but we'll get into that in a moment. But yes, I am a big fan of intermittent fasting and TRE. So patients who can't, don't want to limit what they're eating. Okay, well, don't limit what you're eating, then limit when you eat.
Okay, that's a good compromise.
Don't eat from the time you wake up until the time you go to bed, and you're snacking in between, and you don't go to bed till 11, 12 o'clock at night. No.
No, that's a good point.
Ma'am. So yeah, the body wants to work for us. The body wants to be well. We just have to give it the support that it needs. And so we can't eat constantly throughout the day. We need to give it an opportunity to repair and heal, and to use the foodstuffs that we've entered into the body. Otherwise, it'll store into fat.
Yeah, we don't want to store this fat.
No, ma'am.
Now, let me ask you this. And so these patients, they'll come in and you'll say, hey, you're probably suffering from some ocular surface disease or dry eye. Let's try this natural approach. Just not eat these things for a 3-week period. So what percentage of the patients come back that A, will try it, and B, those that try it that have a reduction in some of the symptoms that they have?
So the part of the number that will actually do what I'm recommending, I'm going to say about 30%. So yeah, there's
Okay,
that
that's pretty
70% that
good still.
they just not right. And
Ain't do
sometimes
it.
repetition is the key to learning. You need to just keep hearing it.
Mhm.
And it's okay because I'm going to keep saying it. So it's perfectly fine. So of that 30% that will actually do what I'm suggesting, I'm going to say upwards 50% will see some improvement. Oftentimes they'll see enough of an improvement where I don't have to do anything more than artificial tears on occasion and continue with
Okay.
the water.
Good. So you're
Mhm.
doing basically a good holistic approach. And this is something that can be a long-term way for them to manage not only their dry eye, but also the rest of their the health issues as well. Because
Absolutely.
yes, if you have those health issues, one is causing your body to be in a more inflamed or inflammatory state. But once you have to start taking on those medicines, then they affect your ocular surface, which is going to exacerbate your discomfort of your eyes. Okay, so I'm learning a lot. I'm like, okay, what I'm eating for breakfast tomorrow? Do I have spinach? Okay. Uh,
Or
oh,
kale. You don't have to do
okay, y'all.
spinach.
I don't know. I like spinach. I like baby spinach. I love spinach actually. Um,
Green
so
smoothies work too.
green
But
smoothie,
go
yes,
ahead.
I do that. I just have to get up earlier. That's my thing. I love my sleep. I have to get up earlier so that way I can have time and not running around in the morning and get everybody where they need to be. And so we talked a little bit about devices. So you say you're going to get to that a little bit later. So of course, if you're eating these things, it's going to help the overall comfort of the eye and the body, but that's also going to play a role into how your eyes feel while you're on these devices. So we both know the device time. One, it plays with your blink rate. So when you're adding these omegas, this is increasing the amount of meibomian and making it thick and healthy. How does that play into the role when your patients are on their computers, their devices at work? How does that work in your dry practice?
So part of my meibomian gland dysfunction is the low blink rate, as you alluded to. And so I have patients actually set an alarm on their phone every 2 hours or so. I want them doing forced squeeze blinking, which is basically squeezing the eyes shut. Do about 5 of those every 2 hours. I have them actually put that in their phone. That's
Oh,
something that
okay.
we do. Also, we have them because a lot of the phones, I don't know, because I'm an iPhone person, but I think the Apple phones have it too, where you can switch into night mode because we know
Yes.
that the blue light that's being emitted from these digital devices are messing with people's circadian rhythms. And so you need sleep, like we talked
Mhm.
about before. So I'm okay with you, Dr. Janelle, having to want, it's that desire to
I
sleep
need
and the
my sleep.
body needs to sleep. Yes, you have got to rest. Rest is
I got to get
important. And
up
so
though. I'm not a morning person. Pray for me.
but if you're spending all your time on these digital devices and you don't switch over into night mode, if your phone has that, then these emissions that are coming from these devices are messing with your circadian rhythms. Now we do offer, lenses like blue blocking lenses that can help with that as well. It also, because you are wearing glasses, will help with some of the uh, convection of the air that's causing some of the dry eye symptoms that people have. And so those are some just mechanical things that we recommend that patients can do. Also, warm compresses. Now, we do recommend what we call a Bruder mask so that people have that weighted warm compresses. But essentially, it's a sleep mask that gives the eye the 10 minutes of warm, continuous heat. I've had even patients that try to do that with tea bags, which is fine. I don't know how well that heat lasts because we want
Uh-huh.
at least 10 minutes of continuous heat, but simply taking a tea bag after seeped it in the hot water, draining out some of the excess hot water and laying that tea bag on the eyes, both eyes, that could be your meditative moment. We all could meditate more.
Mm-hmm.
So that 10 minutes a day doing that. Yeah.
The meditative moment. Those are all some really, really, really good points. And so I guess I was going to have you tell my listeners a little bit about your practice, where you're located. Give us a visual because you have a nice, beautiful house and it's like a big backyard. So walk us a little bit through about your overall practice and how it's a little bit unique.
Okay. So the practice, the building. So I am fortunate that I converted a old house. It was built back in 1950 in McDonough. And so they routinely refer to it as the White House with the pond. So we have a big pond in the
Oh,
middle of the
wow.
house. We are fortunate enough that with that house, we divided it up. And so we have my practice on one half of the house. And on the other half of the property, we have two other tenants that are actually able to house their businesses there.
Oh,
and
wow.
actually, one of my tenants is also a health coach. So she's able to practice on the premises as well. And as you alluded to, because of COVID, and we were constantly getting the request to do, small events outside on the property, we instituted an event space, and we call it the Heart Estate. And so,
yes.
we do that, outdoor events. We've had a couple of parties, small weddings, elopements, what have you. And because we're outside, we're able to social distance. It's beautiful. So you can go online, look us up, theheartestate.com, and check us out there. So yeah.
That's a boss move right there. That's how you take lemons and make lemonade. Boss, that's what's like. You a boss, okay? That is a boss move. You see a need, a demand, and you create a solution. So that was really, you've done that beautifully. Another thing, so I always get a lot of ODs who will contact us or contact me and say, I want to do dry eye, and how do I get started? So what was your start in dry eye? Are you a dry eye sufferer? Like, what made you decide, because we all dibble and dabble in dry eye, but what made you decide I'm going to make this a key focus in my practice?
So being in the South as we are, and most patients have a dry issue. If it's not dry, it's allergies. People are presenting every day. They're using over-the-counter medications. They're using artificial tears. If you ask the question, you're going to get an affirmative answer. Asking the question meaning, do your eyes ever burn, itch, or get red for no reason, or water? Yes. 80% of patients, yes, to one of those three. And so it's simply a matter of breaking it down and educating your patients. Most of the time, unfortunately, it is a disorder. Allergies does play a part, but there are different tests that we can do to rule out if it's allergy related versus dry eye related, such as inflammatory dry and other different tests that we do. So, I would say starting out in the basics, ask the question. And then when they give you the answers, don't just throw that in the back. Address their problem and give them some solutions. The easiest thing to do, you can talk to patients. Okay, first, like we just said, get the water in, drink the water. Let's see you back, and let's run some more tests. You do your Shermer scores, you do your phenol red, your lissamine green. You can see these things are happening. The easiest things to do, of course, we have medications that we start. Cequa, Restasis, Zydra, all of those. I don't really just say, go get an artificial tear. I never tell my patients that. I give them what I want them to have. Exactly. And if I don't have it in the office, I'm prescribing a medication, because that's what we do. There's so many different things out there. It's ridiculous. I do institute Lumify in the digital practice. I had a lot of apprehension about Lumify in the beginning, because I didn't want patients walking around, especially us people of color who want to have bright white eyes. We have a lot of pigmented conjunctiva from melanosis and UV exposure and all of that. And we have that. That's another discussion that we'll have with the patients about their melanosis and all that. But I didn't want them masking actual disease processes. And so that forced, when I put one drop in and we're having the conversation about what dry is, by the time I've gone through my 5-minute spiel, they look in the mirror. Oh my God, look how white. Okay, well, let's fix the other one, but we're going to get you back in a couple of weeks to have a more thorough special. I hope I answered that question.
Yes, you did. You were breaking up a little bit too. That's a good point too. Yeah. So, because we get a lot of doctors who just say, how do I do dry eye? You know how to do it. I guess they get jaded sometimes with the industry about seeing all these big fancy equipment. Those are things that you can move toward, but you don't have to have those things, because the things that you name are things that I do and I started off with as well, which all we learn in school.
Exactly.
You have the tools right in front of you, have the conversation and prescribe everything or recommend exactly what you want the patient to have, because that is a good point with the Lumify, that they can mask a situation. And I never give that as it's an adjunct therapy until we get your eyes to where they need to be, where they're not getting red. But I always say, if you got somewhere to be and you're right looking at you like, what's going on, then we can use that as a part of our therapy. But those are really some good points. So if you guys are on the South Side, this is who you need to be going to. You need to be going to Dr. Santrell Hart-Moreland. If you have an event that you need to have outside and COVID has made you not be able to have your event indoors,
yes,
visit the Heart Estate, okay?
We're taking reservations for next year right now because it is an outdoor space. So come on and get on.
It's too late. Too late for 2020. You gotta start planning for 2021 right now. Okay,
That's
this is
right.
how we doing it.
That's right, amen.
That's a true boss move right there. Man, I need to look and see if I have me a birthday party or something down there. But you can see she takes a very detailed and customized approach to dry eye and any condition that she's managing in her practice. And you will see that the women that I have on this show, that's what we do. We take that extra step to care for our patients and to give our patients knowledge, because I too believe the more you know, the better you do. And optometrists, we are in a great spot to be able to have those conversations because we're busy, but we still have room, not like some of our other providers, care providers, to just spend that time with patients like we do. So I definitely want you to check out Dr. Hart-Moreland. Let them know what your website is. Let them know if you're on any social media platforms. How can they find you if they're down in McDonough, Noonan, what else? Ellenwood, anywhere down that way. They need to be
Ellenwood, Stockbridge, anyone down south, McDonough, Hampton,
Riverdale.
Lovejoy. We're down here, Riverdale, Jonesboro. Come on. I'm ready for you. So it's Elevated Eye Care, elevatedeyecare.org. We fix dry eyes. You can find us, wefixdryeyes.com. That'll get you to the site. I also, if I may, Janelle, I just want to put a little blurb out there for the foundation. I do have a foundation.
I was gonna say, yes, she has a foundation. I was gonna say, don't forget about that as well. Yes.
Yes. So the Elevated Foundation is a foundation that I instituted about 7 years ago. We actually provide health care, complete care for people who are working without insurance. We do not just eye, but we do dentistry, we do OBGYN, we do medications, internal medicine. We give a year's worth of medications. We do an event once a year. Our clinic was canceled this year due to COVID, but we're preparing already for 2021. We're actually going on a mission trip to Kenya in 2021. So those doctors who are listening, who would like to go with us to Africa, please shoot me a message, a DM, or get in contact with Dr. Janelle, and we'll get you on board. But yes, so the Elevated Foundation, please support us as we support our neighbors here in Henry County.
Oh, wow. Yes. And you got a book too. She does it all. Okay. Giving back to the community. Don't forget about the Elevated Foundation. She was another inspiration for me to find my passion and another way to give back to the community, and why I started my nonprofit as well. So if you are a doctor, an optometrist, especially a optometrist of color, a woman of color optometrist, and you do not know Dr. Hart-Moreland, you can find her on Instagram and follow her. Like I said, she has been one of my sheroes since I moved to the Atlanta area. Been here 14 years. The whole time I've known her, and I've always looked forward to seeing her at different meetings and just to see what she's working on, because I know it's going to be great. I thank everybody for tuning in this evening. Once again, this is going to be recorded here on Facebook, but also if you want to see any of the previous shows and this recorded episode, you can go into my YouTube channel at Dr. Janelle OD, your eye care expert, to see all the previous episodes. We're going to be here again next week at the same time. We are going to be talking about a Dr. Home program, specifically some of the Lenovis products that I recommend and prescribe to my patients. We're going to be talking about that. And then we're going to close out the month of October. We're going to do a sample. I'm going to do a live demo of a MABA flow treatment. I'm going to bring my husband back. So y'all don't see, we don't treat him with everything. Now we got to get these oil glands. So we're going to do a live demonstration on a MABA flow, and that's going to be on the 18th of October. Thank you, Dr. Hart-Moreland. I know you got stuff to do.
Thank you, Janelle.
And I appreciate you taking your time being with me this evening.
Thank you. Thank you so much. I love you so much. And thank you for having me on your program. Yes.
Oh, no worries. I couldn't have without you. All right. Bye.
Bye.